Welcome to Summarize Science. Mental health disorders like depression, anxiety, and PTSD are a leading cause of disability worldwide, but they're often underdiagnosed or misdiagnosed. In fact, some studies show that in primary care settings, doctors can miss the signs in over 60% of cases. This highlights an urgent need for better tools to help with early detection. This paper asks a core question: can we use the powerful text comprehension skills of modern AI to detect early signs of these disorders from natural conversations? To find out, researchers from Kent State University used a unique dataset of over 550 real-world, semi-structured interviews. Unlike studies that use social media posts, this one used actual transcripts of people talking about their lives, paired with real clinical diagnoses. This makes the research a much more realistic test of how these AI models might perform in the real world. The team tested several different AI approaches. One method was to simply prompt a large language model like GPT-4.1 Mini directly, with no special training. Another approach involved taking an AI model and efficiently fine-tuning it specifically for this mental health task. So, let's get to the results. Broadly, the AI models were able to achieve over 80% accuracy across the different disorders, which is very promising. However, the details reveal a really interesting and important trade-off. The direct prompting model, GPT-4.1 Mini, had high overall accuracy but suffered from low recall. In simple terms, that means it was good at correctly identifying people who didn't have a disorder, but it missed a lot of people who actually did. In contrast, another large model called Llama 3 had the opposite problem. As you can see in this table, its recall was extremely high, meaning it caught nearly every single positive case of depression, PTSD, and anxiety. The downside was that it also produced a lot of false positives, flagging people who didn't have the disorders. The best-performing model turned out to be one called Roberta that was specially fine-tuned for this task. It struck a much better balance, achieving high scores in both recall and overall performance, particularly for identifying PTSD and anxiety. So, let's recap the most important points and what they mean for the future. First, this study shows that AI can indeed detect signals of mental health disorders from conversations with impressive accuracy. Second, and most importantly, it highlights the critical concept of recall in a clinical setting. From a public health perspective, it's far better for a screening tool to have high recall, meaning it catches every potential case, even if it creates some false alarms for a doctor to review. Missing a true case means that person doesn't get the help they need, which is a much worse outcome. This research lays the groundwork for integrating AI into clinical workflows as a low-cost, accessible early warning system. Imagine these tools helping doctors in busy clinics or reaching people in remote areas where specialists are scarce. This is a major step toward using AI to make timely mental health care a reality for more people. Thanks for watching Summarize Science.